everyone. My name is Jake Switek. I am the PGY1 Community Pharmacy resident. I work here at Wood Street Pharmacy with the team, and today we're going to be talking about the outpatient pharmacy process, especially for those who don't have experience. We'll just kind of talk about the workflow of taking in a prescription, entering it into our system. We'll go through the pre-verification process of what important things the pharmacist has to look at when we're verifying a prescription. The next step, we'll go into the actual prescription filling, so the technician role of filling the correct prescription. And then we're going to go into the verification step, which where the pharmacist looks for drug interactions, looks through the actual prescription that was filled, making sure that's the correct prescription. And then we're going to close it off with ringing out the patient prescription and patient counseling.
I'll be starting with the data entry side of our pharmacy.
I have the paper script here we received, and I've already scanned it into our system. I selected the correct patient, Joe Test, and I verified the date of birth, which is January 10th, 1990. I've entered the correct prescriber as well, Dr. Test, with the correct street and DEA number. And I've already selected the appropriate medication for this patient, lisinopril 10 milligrams. Now I will verify that the date written of the prescription is the correct one we're entering, August 7th, 2020. Now I will enter the SIG for this medication. The doctor said to take 1 tablet by mouth daily. So I will enter take 1 tablet by mouth, but I'll use the SIG code PO, and then I'll use the SIG code QD for every day. Once I verify that the SIG came out the correct way, I'll be able to enter the written quantity, which is 30 tablets. That will also pop up the following to have the dispense quantity, 30 tablets. As you can see on this prescription, there's no refills, so I'll make sure that stays 0, and the refill quantity would be 0 if there were refills allowed. Now the day supply, we'll just do the math. Since he's taking 1 tablet by mouth once daily, that should last him 30 days. Third party is where we would enter the insurance information, but since this patient doesn't have any right now, we'll just run it as cash until we can get it at a later point. As you can see, there's no DAW code indicated from the prescriber, so we'll just leave that as 0. The prescription origin code is written for 1, so that's the same because we just scanned in this hard copy. Everything looks good so far, so we can go to the next workflow step. I'll scan my credentials to get us to pre-verification where the pharmacist will take over.
Residents, and today we're going to be going through the pre-verification process.
So the first thing we do is most often we'll have a DUR, which is a drug utilization review that will come up. And for this patient, looks like just kind of a lactation precaution came up and a pregnancy precaution for the patient's lisinopril. So the first thing that I would look into is, okay, so our patient, to see if they're an actual female, you could click on our patient's chart and it'll pull up all the medications that they're on. So it looks like they are a female of reproductive potential, so it would be an important thing to consider for this patient is just to counsel them on this medication. So the next thing we can do after looking into that DUR is it'll take us to the pre-verification process for the actual type of prescription. This little window just shows us a general copay amount, so it looks like the patient will pay $37.20. We can close this window out, and now for the pre-verification process, the important things I look at are, we have our hard copy script pulled up here. So first things first, I check the patient's name, so Joe Test. We check the patient's date of birth, so we want to verify that it's the correct date of birth on the prescription right here. Prescription written date matches the written date that was typed in correctly. We want to check the prescriber's information, so we have Dr. Test here. Most often we would also want to verify a doctor's DA number on the script. We want to make sure it matches up correctly with the DA number we have on file, and then sometimes they'll offer an MPI number, so I'll also go ahead and verify that. The next thing I'm going to double check is the medication name. So we have lisinopril and strength, 10 milligrams. And then we're also going to verify to see if they typed in the correct quantity. So we have 30 tablets and the SIG for the medication. So right here we have take 1 tablet by mouth daily. So take 1 tablet by mouth daily. and the doctor wrote no refills, so we also want to make sure that there's no refills remaining, and we will be able to actually approve this pre-verification, and it'll be sent for filling.
I will be showing you the product dispensing side of our pharmacy.
As you can see, we are now on the screen for our filling. I'm going to scan the patient's label to verify it's the correct label we're filling. Then I will scan the stock bottle, and I will make sure to scan the proper NDC label. Once that's verified, I can make sure the expiration date matches. It'll be a year from today or sooner if the product is indicated to be so. I see the expiration date is 11 of 2021, so I will set it for a year from today, which is 8/7/21. Then I will enter the lot number of the medication vial. Here I see it is 146G20002. I am now ready to count the amount of medication necessary for this vial. I will open the medication and use our pill counter to count 30 tablets. Now that I've counted 30 tablets, I will pour it into the vial. Once I've closed the vial, I will now label it. And I'll make sure to put all auxiliary labels on the vial as well. Now that the medication is completed, I can put it in the bin for the pharmacist to verify.
And now I will show you the verification portion of workflow. Okay, so this portion of the filling process is verification. At the verification process is very similar to pre-verification, except for at this point you actually have the medication in hand after it's been filled. So for this patient we have Joe Test, so I will still compare what was entered with the actual hard copy and the bottle that I have in hand. So we have Joe Test as the patient, date of birth 1/10/1990, which matches what is on the hard copy. We have the doctor as Dr. Test, which also matches what is on the hard copy. Drug is lisinopril, 10 milligram tablets, 1 daily, so everything that is on the bottle as entered matches what is on the prescription. At pre-verification, the DURs would have already been checked. However, at this point, I still sometimes, especially if it's a new prescription, will look at the DURs that popped up at pre-verification just to make sure nothing was missed. And as I see here, there is nothing that is really a true DUR. So that's fine. When checking the medication that's in the bottle, it matches what is on the screen. The imprint is the same, H146, which is in the bottle. And this one is good to go, so we can verify it to go to patient.
Alright, so what we're going to cover is the counseling process we do in our outpatient pharmacies. When a patient comes to pick up a prescription, we sit down, we either take the patient to a counseling room or take them over to the counseling window. And the first thing we always want to verify is the patient's first name and last name. And we always want to verify the date of birth, just 2 patient identifiers always, just to make sure we're dispensing the correct prescription to the patients. Most often we print out a monograph for the patient too to take home. It has some general information on the prescription, but we also like to cover the prescription with the patient. So I would verify the name, date of birth, and I would ask the patient if he's familiar with the medication, like what medication was he prescribed, and in this case we have lisinopril 10 milligrams. I would further go into the process of if he knows what the medication's for, and I would counsel him on how to use the medication. So for example, for this lisinopril, I would tell the patient, so we have lisinopril 10 milligrams here, you're going to take 1 tablet by mouth every day, and then we would go into some adverse effect counseling and monitoring parameters for this patient. And then just to close it off, we would also just offer the patient our phone number here just in case if he has any questions. Let him know that he also has refills here, and if he needs any further refills, we can always do the courtesy of reaching out to his doctor for him. Thank you for watching this, everybody. Hope this gives you a better perspective on the whole outpatient pharmacy process here, especially how we do it here at Wood Street Pharmacy. You guys will have a lot more opportunities coming up on your IPPs and APPs, and then if you do have any questions, just feel free to reach out to your instructors.